The nice thing about the WVU transitional year is you can kind of adapt it to be whatever you want it to be. By the end of my year, I felt very competent as a doctor in medicine, but it really helps prepare you to transition to your certain specialty where you're not going to be able to have the opportunity to take care of these patients like you do in the hospital during the transitional year.
I think that we're really lucky in that we get 3 months of elective time, and that those 3 months are kind of up to whenever we want to schedule it. It's up to our discretion, and so I was able to kind of time it out how I wanted my training to go.
Since we're a tertiary care center, we really have every subspecialty at our fingertips, and we allow our residents to build out their schedule so that they can rotate in the fields of their interest.
I've loved being able to see a different patient population, be introduced to all kinds of different pathologies that I probably wouldn't see in a more well-populated area with bigger hospitals and places for people to go.
The attendings I've worked with have always done a great job of sitting down and really talking to patients and figuring out what other issues they're having, other barriers to care. They've always been wonderful about taking a little bit of time before and after each patient to go over a learning point.
We have a wide variety of residents. They come with all sorts of backgrounds, and when they get together for the year, they really bond and create a great working atmosphere and support system for each other.
Morgantown has a lot to offer. It's a small, medium city, and there's plenty of opportunities for you around Morgantown in north central West Virginia.
It is one of the most poppin' cities because WVU is here. We have a lot of undergrad culture as well. There's a lot of fun things to do, and it's super close to Pittsburgh, so whenever I want some big city time, I can just make an hour drive and get where I need to be.
I love the outdoors areas. I like to kayak and go hiking, and my family is big into all that, so we wanted somewhere that we would have things to do and be close to family, and this was a perfect fit for that.
I really enjoy the people that I work with, not just my co-residents, but my attendings. I love the nursing staff. I think that it's like a very inviting place to work. I never feel afraid to ask questions.
I mean, there's a reason that a lot of people that go to medical school here want to stay, and it's because they want to be a part of that community.